So the kidney was crying with pain, it was alive. When the kidney died, it stopped crying of pain and it becomes dead kidney. You have seen so many people, they had a stone sometime here, 2 years, 3 years ago, they took some tablets, generally some alternative medicine, and then their pain stopped. They never saw the pain stone pass out. They never saw it. And now the stone has become bigger and the kidney is dead.
You are watching Surgery Simplified, shastrakalasaralshabdomein.
Hello everyone, Namaste. Welcome to our channel Surgery Simplified, shastrakalasaralshabdomein. आज मेरे साथ हैं डॉक्टर निखिल बलजेकर।
नमस्ते।
और आज हम एक काफ़ी कॉमन एब्डोमेन डिजीज़ के बारे में बात करने वाले हैं जो है किडनी स्टोन। मैंने मेरे सर्कल में फैमिली में काफ़ी लोगों के साथ देखा है कि उनको हुआ है एंड देन दे हैव स्ट्रगल्ड विद द पेन एंड एवरीथिंग। तो आज आप और कितना डिटेल में इसके बारे में बात करने वाले हैं?
तो किडनी स्टोन यानी जो यूरिनरी स्टोन इसको बोलते हैं, ओके, बिकॉज द करेक्ट टर्मिनोलॉजी इज यूरिनरी स्टोन बिकॉज द स्टोन कैन बी इन डिफरेंट पार्ट्स. सो वी हैव 3 parts where the stone can be, rather 4 parts of the body. First is the kidney. Then from the kidney there is a tube which is called the ureter. So we have kidney stone, we have ureteric stone, then into the bladder, which is where the urine gets accumulated, you can get bladder stone, and then there is a final pipe going out which is known as the urethra. So you can have a stone in the urethra.
जहाँ से यूरिन पास होता है।
हाँ, so that's why we call it urinary calculi. तो ये भी काफी कॉमन है। अब इसके भी कुछ कारण हैं. The single most important is, rather let me say there are 2 things. The most important is कि जिनको पानी नहीं पीने की आदत रहती, पानी पीने की नहीं पीने की आदत रहती, those people who do not drink adequate water, that is the first and foremost cause of kidney stone. And the second is, some people have a tendency, they are born with a tendency to form stone.
Oh.
Yes.
That's very weird.
Yeah, because many people don't drink water. Everybody doesn't get a kidney stone.
Correct.
So there are people who have got an inherent tendency to form a stone, so they form a stone. So those people who once have a stone, so what is the conclusion of this? If they have suffered a kidney stone any time, then for lifelong they should drink a lot of water, because otherwise they will get stone again. Not only that, even if the stone that is there has been treated with surgery or whatever it is and it has been removed, doesn't mean that they cannot get a stone again. They can again get a stone, and it's very common for patients to come to us with a kidney stone. We ask them, do you have a stone earlier? हाँ, मेरे को 3 साल पहले हुआ था, 4 साल पहले अपने आप पास हुआ या ऑपरेशन करके निकाला था. So in spite of that, they don't drink water and then they again form another stone. So this is very important for everybody to understand, because unlike in a gallstone where the gallbladder is removed, which is the place where the stone forms, we cannot remove the kidney. Therefore the stone will form again if you do not drink or take precaution that you should drink enough water. Now the next question is, how much water do you drink?
I was coming back to that. Yeah.
The simple thing is, the requirement of water is again dependent on many things. First is body weight.
Right.
Second is, what is the type of work you do? For example, a laborer working on the road in the sun, or say an auto rickshaw driver or a policeman standing in the sun, who sweats the whole day, versus somebody who is a software engineer sitting in a AC cabin and doing something. The requirement of water will be different because the amount of perspiration is less.
Correct.
In the person working in an AC atmosphere, or against the person who is working outside in the hot sun, who is likely to perspire more. Again, the amount you perspire is different in different people. Some people perspire more, some people less. So the simple thing is, drink that much water which will keep your urine colorless every time. There should not be any color for the urine. That is the amount of water you need to drink. So whenever you pass urine, whether in the morning, whether in the afternoon, whether in the night, whether in the evening, the urine should not have any color. Now if suppose that is 4 liters for somebody and that is 3 liters for somebody else, that is the amount of water they need to drink. So you need to find out how many glasses of water will keep your urine colorless, and that is the amount of water, maybe 1 or 2 glasses more than that for summer and maybe 1 or 2 glasses less for winter. But all the time it should be colorless. This is the single most important factor which will prevent stones from forming. So how do stones form? Very similar to the supersaturated cholesterol which led to cholesterol stones. Here the supersaturation of the urine, right, leads to formation of stones. Just like in gallstones, you have the phospholipid and the bile acid which kept the cholesterol in solution. Here you have citrate.
Okay.
Citrate, which is there, which is secreted in the kidney. Citrate is what keeps calcium and oxalate in solution. Okay. Also, the pH of the urine is an important part, which will come to that. What is pH? Whether it is alkaline or acidic. Okay. What is the pH of the urine? That is important. So the common stones which are formed are 4 types. One is the calcium oxalate stone, which is by far the commonest stone. So calcium and oxalate, these, when the amount of calcium and oxalate in the urine increases to the level that they crystallize, then that becomes the nidus around which the stone becomes larger and larger. The calcium oxalate stone is generally black or brown in color. Okay. The next is the triphosphate stone. That means it consists of calcium phosphate, aluminum and magnesium phosphate. Now this stone is basically happens in alkaline urine, and it is secondary to infection, similar to the gallstone. Again, infection becomes a reason for stone to formation. And the infection causes the urine to become alkaline, and if the urine is alkaline, then the infection perpetuates, and this stone forms generally into very large stones which are called staghorn calculus. Staghorn means, if you see the kidney, it has got branches like this: upper calyx, middle calyx, lower calyx, and then they come into the pelvis, and so it's like the branches of a deer or a stag. Now this stone fills the entire kidney. Entire kidney forms fills with a stone. It's like a mold of the inner part of the kidney. So that is called as a staghorn calculus. It's a very big calculus, but it's a soft stone. Okay. The third is the uric acid calculus, and this happens in those people who suffer from high uric acid levels, as the ones which you get gout. Gout is a condition which causes pain in the joints, and this is predominantly in people who eat a lot of red meat. Red meat is uric acid stone. So those who have uric acid which is high, they need to take tablets to reduce the uric acid level, and they should become vegetarian. Then they can avoid uric acid stones. These are hard crystal like stones which are crystal. The calcium oxalate stones are like your COVID ka that virus is shown, no, with horns like this, round. Phosphate stones are smooth and large and whitish in color. The uric acid stones are like needles, generally like needles. The crystals are like needles, and the stone can be very hard. And the important thing is, the first 2 stones are radio opaque. That means on a plain X-ray you can see them. Uric acid stones you cannot see, they are radiolucent. So if you take a plain X-ray, you may not be able to see the stone. And the last is an uncommon stone called cystine stone, which is related to a certain condition called hypercystinuria, which is a rare condition. Let's not discuss it in detail. Okay. The commonest stone is calcium oxalate, and then the second is phosphate. Third, in people who have uric acid. So depending on where the stone is, you will get symptoms. So suppose the stone is in the kidney, the pain is going to be here in the loin, like this, just below your rib cage, because the kidneys are over there, right? Now if the stones are small and they slip into the ureter, then depending on where it is, upper, middle or lower ureter, the pain can be either here or down, or towards the pain going towards the genitals, that is either towards the penis or the testicles in males, or towards the vagina in females. this pain will be radiated towards that, indicating more or less even from the symptom where the stone might be, whether it is in the tube or whether it is here. And if it is in the bladder, then the patient gets very severe pain while passing urine and frequent urination. Bar bar, because that stone keeps irritating the bladder and the patient feels as if he wants to pass urine. You know, so because the stone lies in the lower portion of the bladder, which is a sensitive part called the trigone, where when urine forms that trigone, you get the sensation of, that is the one which is responsible for the sensation of feeling the what that you want to pass urine. So when the stone keeps touching that, patient keeps feeling that he wants to pass urine, but he is not able to pass much urine because the urine is not collected. So if every 15 minutes you go to pass urine, you are not going to pass much urine, right? So most important symptom of bladder stone is what is called strangury, which means very severe burning and small frequent urine passage. That is bladder stone. Ureteric stone will be pain radiating from above downwards towards the genitals, and kidneys will be restricted to this part. Now, what are the tests that you normally do? The first would be to do a urine test, which will show some blood in the urine in the form of RBCs in the microscope. When you see the urine under microscope, maybe some white cells, because many times it is associated with infection, and it will show calcium oxalate crystals because they are crystals. So urine test is very important, and a culture. We do a urine culture because we want to see what kind of organism is there in the urine, which will help us to give the appropriate antibiotic. So if the urine culture is positive, then we need to give antibiotics. Then we do an ultrasound. The ultrasound is good to diagnose stones in the upper part of the urinary tract, that means in the kidney. But once the stone comes down into the lower part of the ureter, ultrasound is not very reliable. The third is a plain X-ray. As I told you many times, unlike gallstones which are not seen on normal X-ray, they are radiolucent. Here the common kidney stone, that is calcium oxalate and phosphate, are easily seen on an X-ray. So you can even take a plain X-ray and ultrasound to diagnose kidney stone. However, the best investigation is to do a CT scan. It is almost, if the CT scan, you can say if the CT scan is negative, then you don't have stone. Right? So how does the patient present? The patients come with very severe sudden onset pain associated with vomiting, but no fever. Okay, unless they get urine infection, then they get fever later on. But pain associated with vomiting. Now this vomiting, why is it? Because of the pain. It is a reflex vomiting. Very severe pain causes vomiting. It has nothing to do with vomiting, nothing to do with the stomach or anything, but the vomiting is reflex. Because of the severe pain, they get vomiting. And the pain starts generally in the night, because when you are sleeping, the kidneys are lying like this. Again, there is stasis. And crystals, which they float up and then they go and block the urine. Many times there is no stone, it is just crystals which are blocking temporarily and they get pain. Even if it is a stone, it tends to float up and go and block the ureters in the sleeping position. So very often sudden severe pain when a person is woken up from sleep and that pain is in this area, more or less diagnostic of kidney stone. If you do an ultrasound or a plain X-ray, you may be able to diagnose most commonly. Otherwise, you have to do a CT scan. What is the treatment for this? Treatment is very simple. Initially, all you need is to control the pain with the help of a painkiller injection. There is no need to do anything in emergency. Okay? Most of the times, the pain stops. Now the question is, stone to udhar hi hai, so pain kyun band hua? Then we only know there is one answer, GOK.
GOK.
God only knows. We don't know why when the stone is there it caused pain, and why it is not causing pain now and the pain has stopped but the stone is there. We don't know. Probably the stone shifts its position.
Got
okay, and then it allows the urine to pass. We don't know exactly what is the reason, but this is 100% that you give 1 or 2 painkiller injections, the pain generally stops or reduces to such an extent the patient is generally able to do his normal work.
Bearable.
Yeah, his normal work. So it tends to avoid surgery. Now comes the next thing. which people do. They don't want to go for surgery, so they start doing Ayurvedic treatment and this treatment and taking bhasma and this and all. This is all nonsense. Please do not waste time because you will spoil your kidney. If the urine is blocked by a stone and that stone is more than 8 millimeters to 1 centimeter in size, chances are that it will not come out on its own and you need to take surgical treatment. Postponing it is only going to spoil your kidney.
Or
doing all
increase
this
the size.
all this kind of other treatment is all, it doesn't work. We have seen lot of people taking Ayurvedic treatment and so on, and their pain stops, they think the stone has passed out. Then they come with kidney failure. Because what happens is when the kidney is blocked over a period of time, after some time it dies and so the pain goes. The pain going in such a patient is not a sign of stone passing out, but the kidney passing out. So the kidney was crying with pain, it was alive. When the kidney died, it stopped crying of pain and it becomes dead kidney. We have seen so many people, they had a stone sometime 2 years, 3 years ago, they took some tablets or they did something, generally some alternative medicine, and then their pain stopped. They never saw the stone pass out. They never saw it. They never went and bothered to take another ultrasound or X-ray or CT scan to see if the stone is still there. And now the stone has become bigger and the kidney is dead. So please, again, the take-home message is, if you have a stone, either you need to follow up with regular ultrasound to see whether the stone is still there, and if the stone is there, and stone which is going to come out will come out within 3 weeks. If it doesn't come out within 3 weeks, you can assume this stone is not coming out, statistically. So you drink a lot of water to see whether the stone will come out on its own. There is a medical treatment, we also give it. We give some Lasix or something which will, make the stone come out with lot of water, and we give something which will relax the ureter and hope that the stone comes out. But again there, only if the stone is smaller than 8 millimeters and if it is in the lower part of the ureter. If it is in the kidney or in the upper part of the ureter, then the chances are very less that the stone will come out on its own. So you need to take some treatment. Now today the good news is that almost every stone, no matter how big, whichever size and wherever it is, it can be removed through a telescope with the help of either a pneumatic lithotripter or a laser.
So they burst it.
They break it, like the tuck, that is pneumatic. It works on pressure. So it's a probe which goes on, keeps hitting and breaks the stone into powder.
Acha.
Okay, either you can make a small hole from above, pass a telescope directly into the kidney, break the stone and remove it from above, which is known as PCNL, Percutaneous Nephrolithotomy. Percutaneous means through the skin, nephro means kidney, lithotripsy means breaking of the stone. So PCNL or ureteroscopy, URS, which is to pass a telescope, rigid telescope, from the penis or the vagina, the urethra right up to the kidney, but it reaches only the upper 2/3 and the lower 1/3, upper 1/3, lower 2/3 area. It cannot remove stones above that. Now there is a blind area between the kidney and the upper 1/3 of the ureter. Now there is another one which is called RIRS, that is retrograde intrarenal surgery. Retrograde means from below, intrarenal, that means it goes up to the scope. So now there is a flexible ureteroscope which is also called as a ureterorenoscope. That means it's a flexible scope which is longer and it can be moved inside. It moves like this, right? So it's passed from the genitals up to the kidney and it can bend and go into the calyces. I told you there are 3, upper calyx, middle and lower calyx. So it can go into the kidney, it can go here, it can go here, and then you can use a laser fiber to break the stone. So this facility is now available.
Achha.
Okay. So PCNL, RIRS for kidney and upper ureteric stones. Middle ureteric stones is rigid ureteroscope, and bladder stone also through the scope you can do. There is one other treatment which is non-invasive, which is known as ESWL. When it was invented, it became the rage. It's called extracorporeal shock wave lithotripsy. So what that does is, you lie on your tummy and there is a image intensifier which will localize the stone, and then there is a machine which gives shocks, tuck, tuck, tuck from outside, and you can actually see the stone break. Now this is good for stones which are less than 1.5 centimeters and which are in the kidney or just outside the kidney in the upper ureter. Because below this, the pelvis, the shock waves don't go very easily. It's difficult to position for ureteric stones. It can be done, but there are easier methods of doing through the scope. So it's usually done for stones which are in the kidney which are less than 1.5 centimeters.
Okay.
Now there is one stone which cannot be treated with ESWL, and that is the lower calyx stone. That means there are 3 branches in the kidney. One is the upper branch, middle branch and the lower branch. Now if the stone is in the lower branch, even if you break it with ESWL, the powder will not come out because it is against gravity. So this kind of stone, the good treatment is either RIRS, that means you pass a telescope right into the calyx and break it with laser, or you have to do a PCNL. So other than the lower calyx stone, any stone in the kidney which is less than 1.5 centimeters can be treated with a non-invasive method of ESWL. So you have to go to a center which has all these facilities so that you can be treated properly.
Okay. And to avoid getting kidney stone, you must have good
Drink
amount
water.
of water.
Now there are a lot of people who say you should not eat tomato, you should not eat beetroot, you must not have wine. Uric acid, stones, cheese and wine are 2 things other than red meat you should avoid. But more than trying to remember what not to eat, it is best to remember to drink a lot of water. No matter what you eat, you can't eat that much tomato to cause a calcium oxalate stone. It's not possible. The single most important thing is drink enough water to keep your urine colorless, and then you will avoid stones. But even if you have stones, you don't have to now undergo open surgery. It is almost unheard of to do an open surgery for a stone any longer. Okay? So as I said, the only reason maybe where you may need to do open surgery is if there is a blockage somewhere. Just like in the gallstone, we discussed, one is supersaturation of urine, second is infection. But the third is if the urine is blocked, that means the passage of urine starting from the kidney to the ureter, to the bladder, to the urethra. If there is no blockage anywhere, you won't get stone. But if there is a blockage, then you may need some additional surgical procedure, which may not be possible only through a telescope.
Got it.
It is sometimes possible to also stretch that or remove the blockage through a telescope, but not always. And there is a good chance that an open surgery to remove the blockage and cut that blockage and join the tube again, may have to be done.
Okay.
But other than that, almost 95% of the times, everything can be done by minimally invasive endoscopic surgery.
Understood. All right. Wonderful. Thank you so much, doctor, for very insightful discussion on kidney stone. So all our viewers out there, if you have any questions regarding this episode or anything that you want to share, you can put it out in the comment section below. And अगर आपके पास कोई दूसरा suggestion है जहाँ आप चाहते हैं कि doctor can enlighten all of us, then do let us know on that as well. And if you like this episode, please subscribe our channel, hit that like button and the bell icon as well for notifications, and stay tuned for more episodes. Thank you.
Thank you.